All right, so we're going to do the MMT for the Fibularis Longus or the Peroneus Longus, same thing. So it's really important to know the origin, insertion, and action for this. So it's going to make an accurate MMT. So let's talk about the action first. For the Fib Longus, it's a plantar flexor and everter. And a little anatomy review, let's talk about the origin. So essentially it's going to be right here at the head and superior 2/3 of the fibula. It's going to travel down right behind the lateral malleolus into the medial cuneiform and the first metatarsal, that first MTP right under the big toe. So patient positioning, I'm going to ask the patient to bend the knee for me, please. Nice. So I'm going to be on the inside of the testing leg, so we're testing that right side. We'll just talk about where my hands are going to be. My right is going to be the stabilizing hand. It's going to be on top. Make sure I don't block the tendon, that track. So it's just right here. My left hand, or the moving hand, is going to be right under the foot. Pretty much what's important here is my thumb is under his big toe. And what he's going to do is point and scoop out. But it's really important, I want to emphasize your vectors. So you're not just pulling a pull, you're pretty much going to putting them into dorsiflexion and inversion. So you want to look at my angle here. I really want to work in this area, this vector. So we're going to go ahead and have the patient perform the action. So sir, go ahead and point your toes and scoop out. Cool. Hold that position. So again, breaking it down under his foot. I want you to push your big toe into my thumb, okay? And don't let me pull. So vector is this way, stabilizing hands this way. All right, so now we're going to do the MMT for the Fibularis or Peroneus Brevis. So talking about the origin insertion, the origin is going to be the inferior 2/3 of the lateral surface of the fibula. It's still going to travel down, but the insertion is just going to be at that base of the fifth met. So that little landmark right here. So similar position as the Fib Longus, I'm going to be on the inside of the testing leg. So again, vectors are super important. So it is a plantar flexor and everter. So what I'm going to pretty much do is ask the patient, go ahead and point your toes and scoop out. So just breaking down hand positioning, my hands are just like so. So we're not blocking the first MTP anymore. We're just like this. So go ahead and point and scoop out. Nice. All right, so go hold that position, stabilize hands on the top, and I'm pretty much just bringing them into dorsiflexion and inversion. Hold that position, don't let me pull you. Nice job. So again, vector is going this way, you're not just pulling. Right, so we're gonna do the MMT for the Tibialis Anterior, the tib ant. So tib ant is gonna be a dorsiflexor and inverter. So let's talk about the origin insertion. So origin is going to be right here on that lateral surface of the tibia. It's going to go all the way down to the medial cuneiform and then to that first MTP. So for presentation purposes, we're going to be on that. I'm going to go on the left side. So go ahead and bend your knee for me, please. All right. So again, we're talking about vectors, right? So I'm going to pretty much going to be pulling them into plantar flexion and eversion. So if they're going to go into dorsiflexion and inversion, my vector is this way. So I'm going to be pulling this way. So first we're going to go ahead and ask the patient, go ahead and point your toes up to the sky and scoop in. Nice. And you can see the tib ant firing. So go ahead and perform that one more time. Hold that position. So I'm just under, like so, pulling them into plantar flexion and eversion. And again, my vector is this way. So I'm pretty much going to be under. I don't want to block the tendon, like so. And I'm going to go ahead and apply my vector and my force. Don't let me pull. Nice job. All right, so we're going to do the MMT for the Tibialis Posterior, or the tib post. So we know that for the tib post, it's a plantar flexor and inverter. So let's talk about the origin insertion. So it's going to be behind the leg, but the origin essentially is going to be at the posterior surface of the tibia, inferior to that soleal line, so like right here, and also the inferior surface of the fibula. So let's talk about the insertion. I'll actually go here so you guys can see. Can you bend your knee for me, please? So we talked about the origin. So for the tib post, it's pretty much going to travel. Insert's going to be at the system tactile of the calcaneus, which is that little shelf. It's going to wrap into the navicular cuneiforms and the cuboid, and it's going to be at the base of the second, third, and fourth metatarsal. So yeah, it inserts to a lot. So again, it's a plantar flexor and inverter. So we're talking about vectors and correct side. So I'm going to be on the outside of the testing leg. So if this is the left side, so again, the action is going to be a plantar flexor and inverter. So what I'm going to have my stabilizing hand on the top, because you don't want to be blocking that route. So it's going to be on the top like so. And for me, I'm pretty much just going to go right under the foot like this. So I'm going to be pulling them into dorsiflexion and eversion. So my vector is this way. So again, so go ahead and I'm going to ask the patient, go ahead and point your toes and scoop in. Right? Cool. Hold that position. So again, vector is this way. I'm stabilizing the top hand. Right. Don't let me pull. Nice job.